Hello everyone, I just want to make a quick video on the changes we made to PubMed literature search. So for literature search process, we use at least two databases, which is PubMed and Web of Science, and we keep everything the same as the search term here. For example, this example here for Web of Science. The only changes are for PubMed database. So previously, we used the key term. We define key term with PICO. So PICO, population or problem. Intervention stand for I, C stand for comparison, which is optional, and an outcome stand for O, so PICO. So we generate these terms based on that. And outcome are usually not exactly a key term unless you're focusing on a specific outcome, since most of the review outcome are generated based on the articles you found. So with that, using this example on a literature review, systematic review on the intervention of contraceptive in low socioeconomic status population, and looking at the policy effect with contraceptives. So this is a key term that we generated. So the first one I highlight here in the Google search bar is about policy. So that is an intervention, as you can see, is an example of intervention. So, and then these, so that will be I. So I is separate with an. And then the topic, the problem, P, is also separated by another and with the population. So you can see the population are separated by or. So all of these, for example, the policy that I highlighted just now, they're all separated by or. So because they're all talking about policy as a whole, so these are just synonym policy that you come up with. And then the star here just saying that the ending can vary. So this can be legislation, legislative, legislations, so plural. So this is why we add all these. And then for this law, we added law or laws, plural and singular spelled out, because when it's too short of a term, the star doesn't work. So in contraceptive, you can see that we use quotation, which means it's searching in phrases. So that means when we put quotation around birth control, is saying is look for exactly as it is, birth control with a space in the middle. All right, so let's go ahead and see what is the new changes with PubMed. So go to the homepage of PubMed. And the new changes is because PubMed has this thing called MeSH, so it stands for subject heading. And this is basically a tag that people read through every article in the PubMed and then tag them for a specific topic. So this will help you find articles for your specific topic more easily and ensure a comprehensive search. So what you do is, all right, you're here. So you type in, what do you want to see? Legislation. So let's type in legislation. You can see here, click search. Just typing one word, you don't need to use the synonym of it. And in here, we see a bunch of different results. So we check the ones that is relevant to us. So you want legislation as a topic in the articles we search. So not as a type of publication. Publication type means the article we found is a law or legislation itself. So we don't want that. And then scroll down, we see legislation medical is also what we're interested in, since we're talking about healthcare and legislation, and maybe hospital too. So we check that and keep going down the list, but we end up seeing we only include these three. So what we do is you go to here, and remember, since they're all talking about the same thing, the intervention, same intervention, which is policy or legislation here, then we separate by or. So we click or and add to search builder, and then we search PubMed. So with this, the PubMed will bring you to the PubMed page that you normally see, and then it add bracket with MeSH. So that just indicating you search with subject header. So you go to events to change your searches a little bit and to add on the keyword we defined previously. So let's see. So we define these, all of these are the potential keywords, mean the same thing for legislation policy. So we copy and paste this without the parenthesis. So we copy and paste into here, enter search term. I want to use only title and abstract because we don't want, maybe someone's name is law. We don't want that, right? So we only want title and abstract. And then in the query box, you found the last search term you did, which is here. So click the 3 dot, add to query. So we want to combine, this is what we basically do right now, is combine what we've done using MeSH, the subject heading, and our own key terms. So when we're combining and they're all talking about the same thing, the intervention, same intervention here, so we add with or. So here it is. You have or, and then you click search. So that should bring you to, it may seem like a lot of articles, that's because we haven't applied any filters. So don't worry about that. But you basically repeat the same thing for each pickle item. So now we want to do the same thing for contraception, same thing for population here. So what we do, we basically go back to the homepage of PubMed. So everything will be saved, your searches will be saved, you make an account with them just in case. But even without an account, it may be able to save, but just making an account just in case. So remember going back to here, database, and then do the same thing for other terms. Remember to only enter one word. So we want to do, see. So we can do the same thing here, but I have already previously identified multiple searches. So we can just use that instead of doing, so you guys can do the repetition, the repeat yourself. And we can just, so after you do the same thing for, so we just did the legislation, right? So we want to add this to the query. And then we repeat the same thing for social element status, which is here, which is the same thing I did. So let me add this to query. And when you add this, since they're about different topic, right? So legislation is about intervention. And this one's social element status is about population. So you want to add with and. So you add with and then let's see, we need to find the search that we previously did for contraception. So it is here. So I found it because I did it before, and also add with and. So after you add this, don't change anything because it looks scary, but the system did that for you. So just click search. As long as you make sure you use and or right, then it should be good. And after you click search, wait for it. And then here, you see, the article is only 300 compared to like thousands of 100. All right, so here is what you would do to apply all your filters. So the changes, know the changes, we don't want to click full text because full text mean full text in, let me charge my computer. So full text mean full text in PubMed only, but we can find these articles, full text article from other database or from UF or using Science Hub, a website that allow you to see the full article for free. So you don't want to check that, but you can limit the years to 10 years or however determined by your inclusion, exclusion criteria, and then English. And then in the case that you want to exclude any review, you can do that as well. Or you can go to additional filter to add geographic, things like that. But some of the filter be wary of using, such as human, since not every article may be tagged with human, and it's kind of intuitive that these research for contraception, for example, should be all human anyway. So you don't want to check this since that will really limit your search. So now with this, you get a really good comprehensive search. So this is where you download a citation, upload into Covalence, and keep everything else the same. So to summarize, you only change your key term search method for PubMed using subject heading, which is what it is, MESH. And then add on to wherever. So basically it's the same format as here, but you only within the or, within this parenthesis for policy legislation here, you add on legislation MeSH, just to make sure that you include a tag for that item. So that's what you do for each one. And there you go. So that's all you need to do. All right. Feel free to reach out if you have any questions, and I will send a summarized message in Slack as well. Thank you guys. Bye.